Welcome. Today we're going to be talking about how to address community food security, Montgomery County, Maryland solution. Everybody is, your audio is silenced, but you have the chat box. So please use the comments or the chat box feature to share your comments and your questions, and there's plenty of time for Q&A at the end. So let's dive into our time together today. Next slide, please. Thanks. So what we hope you get out of your time with us today is 4 key takeaways to addressing food insecurity. I know that's what's brought us together, so we'll talk about sort of how this work can be sort of divided up in some ways. We'll provide some examples of strategies so you can take action in each of these 4 key areas. And then we'll talk about some lessons learned collecting important community level data to better understand and address food insecurity. So our agenda for today, next slide, please. Is the big challenge around food insecurity and the impact it's had in our communities, particularly in the face of COVID-19. We'll talk about the drivers of food insecurity. We'll talk about those strategies that communities, local community-based organizations, funders, government agencies can put into place to address food insecurity. And then also we'll hear from our speaker, Netta Squires, who's going to talk about how this work is played out in Montgomery County, Maryland. So it's that application real world example, and then we'll have plenty of time for question and answer. Next slide, please. So here's who will be speaking with you today. I'm Evelyn Young. I'll be your host. I'm a senior associate at community science. And what makes me passionate about this work is being able to work with local community organizations, collaboratives, multi-stakeholder groups, and helping them think about local issues and problems like food insecurity, and figure out how to do this work collectively, collaboratively, with a systems lens, with an eye toward addressing inequities, and also looking through the data, making data sort of fun and accessible, but understanding it's not just for outcomes, but really should be around learning and celebrating successes. So that's sort of what excites me about this work. And I'm going to pass it over to our co-host.
Thank you, Evelyn, and thank you everyone for joining today. My name is Elisa Gonzalez. I am an associate at community science, and what brings me to this work and excites me about this work is primarily my own experience. I am from Puerto Rico, which is a place that is chronically and historically food insecure. So that experience really drives me to want to help organizations, agencies, and communities to not only meet residents' food needs, but also to build their capacity and to understand how they can better address the systemic factors that make some places and some communities particularly vulnerable to food insecurity. So thank you for joining all for this session today.
Great. And in addition, we'll be hearing later on from Netta Squires. She's the National Capital Region Emergency Preparedness Specialist at Montgomery County, Maryland. She works in the Office of Emergency Management and Homeland Security. So we will have a conversation with her a little bit later on in the presentation to talk through what Montgomery County has done to address food insecurity during the pandemic, and also how are they thinking about recovery in this stage of things. Next slide, please. So quickly, a little bit about community science. We are a research and development organization. We work with governments, foundations, nonprofits, and other types of organizations to really collaboratively find solutions to social problems. And so it really, our work is really focused with a strong community and systems change lens, and also while also fostering learning and capacity building for social change. So the work we're going to talk about today and the work that Elisa and I do at Community Science is really in our health equity and behavioral health equity portfolio. And so throughout all of our work at Community Science, we're really grounded in systems change, capacity building, and also, how does this work happen equitably, whether it's evaluation or planning or implementation on the ground. How do we change those systemic issues that are behind a lot of the issues that community members face? Next slide, please. So what is this big issue that has brought us together? And I think all of us on the call today are here because we agree that it takes a community to feed a community. And I think we've heard this said during this last year at some point by someone that the pandemic brought out the best in us and the worst in us. And the worst we definitely saw with the hoarding of toilet paper and violence, when people needed to wear masks indoors for their own health and safety of theirs and others. So there's that. But on the other side, there are these incredible stories, personal, professional, that we've seen in our lives and in our communities and on the news, where neighbors have helped neighbors and people have really gone above and beyond to help those in need during this pandemic. And I remember a conversation I had with the pastor in Montgomery County, Maryland, who wanted to be able to help supplement the meals provided by the school district to students, and knew that those meals, they didn't have those meals during the weekends or snacks. And so he really wanted to figure out how he could create a pop-up, so the food assistance site, to provide additional meals to families, so the bridge those meals provided by the school districts. And so you saw we talked about how to link to existing food assistance network, and he could work in different ways and be part of this food system during the pandemic and part of the solution. And so it's stories like that are really inspiring and really shows us like the importance of taking a broad systems lens to this work. We all have to come together. It's multiple stakeholders and partners. It's the faith-based communities, it's the existing service providers, county, local agencies, government, the community-based organizations, funders, researchers and evaluators. It really does take all of us coming together to really make a dent when it comes to food insecurity. And also, I think there's a recognition that there are deep disparities when it comes to food insecurity. Certainly, households of color have higher rates of food insecurity compared to white households. And when we look at this across the board, it really does drive the need for systems level solutions. And it's not just about food access and the services that are available, but really about, what does the system look like? How are we dismantling the systemic inequities that really drive food insecurity? So I'm going to have Elisa talk a little bit more about that. To the next slide, please.
Thank you, Evelyn. So we wanted to start by providing some grounding on the factors that drive food insecurity. And these drivers are interconnected and overlap with each other, but we still wanted to highlight some specific elements of each of them. And of course, we start with poverty. As we all know, having a low income and living below the poverty level are key factors driving food insecurity. But apart from merely poverty levels, we also consider the self-sufficiency standard, which is the annual income required in a given location for a household to be able to afford basic amenities and necessities, including food. And then we have unemployment. And here we include not only being unemployed, but also underemployment, being underemployed, which is of course associated with lower incomes and higher poverty levels. And then we have access to food. And here we consider, of course, availability of income and financial resources to acquire food. We also consider transportation because we know that residents without reliable transportation may be limited in their ability to access locations offering healthy food options. We also consider food assistance ineligibility, which is what happens when families or households or individuals earn too much to qualify for food assistance programs or benefits, but really do not make enough to reach the self-sufficiency standard that we mentioned earlier. And we also consider here barriers to access to food assistance apart from eligibility, which could be lack of providers in a given place, or when residents don't participate or enroll in food assistance programs due to lack of awareness, need for navigation support, stigma, or concerns due to immigration status, among many other factors. And finally, we have the availability of food, and these issues are related to the extent to which food is available in a given location or community. And as many of you probably know, the concept of food desert was introduced to refer to geographic areas with limited availability of grocery stores or other sources of healthy food options. But more recently, this concept has been revisited and rearticulated as food apartheid to bring attention and really highlight what are the structural and racialized forces that have historically limited availability of healthy food options in communities of color. And under food availability, we also consider the availability of culturally acceptable foods in a community or in a place. And by this, we mean food products that are part of a community's food traditions and that are in alignment with cultural or religious practices. So with that, I'm going to send it back to Evelyn with the next slide.
Great, thanks. So what Elisa points to is the food security, so the tip of the iceberg. There's a lot underneath that drives and causes food insecurity. And so we really need to be aware of that and think about that in our solutions locally. It's also important to understand some of these broader contextual factors, and there are emerging concerns that are really imminent to the crises facing residents across the country. So expanded federal and local assistance will soon end. The CDC did recently extend the federal eviction moratorium. That's only through July 30th. So it still leaves 10 million Americans who are behind on their rent in a very uncertain, precarious situation. Additionally, local funding that had really expanded food security aid during the pandemic is also likely to end. It's hard to sustain some of the extra resources that went in to communities to do sort of extra food assistance work. It's hard for communities to sustain that ongoing. And so what does that mean for households that have been relying on other ways to access food during the pandemic as these resources dry up for them federally and locally? Also, it's the real understanding and acknowledgement that the economic recovery may be slower for communities of color. We know that food insecurity rates increased across all racial groups in 2020 due to the pandemic. Some recent research from Feeding America has looked at what it looks like now in 2021 as we're moving into recovery. And there are some indications that for white households, they're experiencing improvements in their food security status. That's not the case for Black families and households. Their food security status is similar to last year's. And so economic recovery, the impact of pandemic on food security will have lasting consequences for our communities of color. And this just points to the ongoing struggles to address systemic racism. We need to bring increased awareness and attention to how racism shapes the food system, but this goes beyond who is accessing food and really has to look at, how food is produced, so the agricultural food production side, who's involved in the food system, who's making decisions around issues around food sovereignty, local food access. And so this is really issues of like deep structural and systemic ways that the food system sort of operates that need to be addressed because they certainly are impacting the food system in inequitable ways. Next slide, please. So that just begs the question, how can we address food insecurity with a systems lens, which we realize is broad scale, long term, which is really important. At the same time, where are opportunities to take immediate action because families and communities are in crisis now. And so we are going to help answer this question for you all today in the next 45 minutes or so. So next slide, please. So what we've done and what we've sort of summarized here are 4 keys to successfully addressing food insecurity. This is based on our work in Montgomery County, Maryland. We've worked with partners in Montgomery County for at least 5 years, and also other community-based or community improvement initiatives, place-based efforts, and other projects science. So what we've seen are sort of generally 4 sort of areas that need to be addressed. The first is strengthening food assistance programs. Availability, access to food, building capacity and coordination and collaboration among the players and stakeholders and the groups and agencies, all doing this work to make sure it's sort of aligned and strategic. Also approaching food security as a social determinant of health, going upstream, understanding that, that poverty, unemployment, food insecurity are all linked, housing, et cetera. And so what does that mean for our approach? It's bigger and broader than just, a single issue. And then establishing local systems to collect and share data. Data are really important. It should be informative to what's going on in the community and also track changes over time and understand where those disparities and inequities show up in our communities and our systems. So let's talk about each of these individually and we can dig a little bit deeper into the strategies. Next slide, please.
Okay. So we wanted to provide some examples of strategies that, like Evelyn mentioned, have been implemented here in Montgomery County for each of these areas and that community science has supported in various ways. And first, we wanted to highlight strategies to strengthen food assistance programs and services. And this includes offering training and capacity building support to food assistance providers, such as connection with resources and information, opportunities for collaboration and local networking, grant application support, and advocacy training opportunities for food assistance providers to be able to participate and contribute to policy advocacy efforts. Here we also include the importance of facilitating connections between food assistance organizations and other service providers or agencies. And this includes housing and utilities assistance, connections to primary care, referrals to workforce development opportunities, among other sources of support that can really help food assistance providers to build their capacity to not only meet immediate needs, but also to respond and to be able to address those drivers of food insecurity. Then we also have strategies that have been tried here in the county to offer evaluation and data collection assistance to food assistance providers. And we have seen how county and partners have facilitated the implementation of evaluation and data collection strategies among food assistance providers, including collecting data, measuring outputs and outcomes, and communicating their results and their impact to funders and to the general public. And then under this area, we also include engaging and involving intended beneficiaries of food assistance programs and services. And this is important because this will help, this is part of building their capacity to better engage beneficiaries and to better understand their needs and the barriers that they have, not only to accessing their programs, but to just being able to access food overall, and use their input and their direct participation to improve their programs and their services. So next slide, please. Thank you. The other area, the second area that Evelyn mentioned is the importance of building capacity for coordination and collaboration among local food system actors. And some of the strategies that have been implemented here in Montgomery County are first, the strengthening of food policy councils, of the Food Policy Council by supporting their operations and facilitating coalition building. And a recent success of these collaborative efforts here in Maryland was the passage of a state bill to establish the Maryland Food Systems Resiliency Council. And this council will be bringing together experts in food systems resiliency and other food system stakeholders across the state to really address food insecurity equitably and sustainably. But this success was really catalyzed by the coordinated advocacy efforts of a coalition of local food policy councils, including our local here, Montgomery County Food Council. Another collaborative strategy that has been tried locally here, but at the school level, is the establishment of school wellness councils. And these councils have representation from the school community at large and work to develop and implement plans to improve wellness with a focus on nutrition and food security for the school community. We also saw the development of partnerships between food assistance providers and faith-based organizations. And these are organizations that tend to be trusted by community residents that have already established ties with community residents. And we saw how this proved particularly important during the pandemic to reach vulnerable populations, such as undocumented residents, the homeless, and also those who are in the process of formalizing their status, who tend to be concerned and wary of reaching out to formal food assistance programs. And another key element of collaborations that we wanted to highlight that has been implemented here is the development and establishments of mechanisms for community residents to participate in strategy development and coalition. And for example, we here at the Montgomery County Food Council organizes a Food Security Community Advisory Board, in which members share their experiences of food insecurity and provide input regarding the organization's policies and practices. And we saw how the engaging residents in food security strategies and the development of food security strategies during normal times contributed to building that sense of community also, and that trust that became really important then to increase the effectiveness and the reach of response efforts during the pandemic. So I'm going to send it back to Evelyn now for our next slide.
The third key is approaching food security as a social determinant of health. And this really is about aligning food security with broader community health improvement efforts. So it's about defining health broadly and breaking down those silos. Unfortunately, organizations that built on your funding streams, you're doing work around food insecurity or health and wellness in the school, or safe routes to school or complete streets. And so what are the ways to sort of align these different community improvement efforts into sort of a broader approach? So taking the example of efforts to improve wellness and physical activity by making safe sidewalks, crossing spaces on the road, can also, well, it also focuses on physical activity, but also is a way to help residents access markets, food assistance sites as well. So there's clear linkages here as schools are approaching, as Elisa talked about, they're developing local school wellness councils that are focused on health and nutrition. What are the ways that school becomes sort of the wraparound entity where food security screenings are happening, services are provided to the family, healthcare provision is provided in the school. So there's a way to think about health broadly versus single issue, which is, I think, typically how a lot of us do. Some of the work happens down at the local level. And so an example of this, which has been really intriguing, that came out of Montgomery County, was we evaluated a partner that integrated food insecurity screenings and referrals within the healthcare setting. And so they operated some of the safety net clinics within the county and knew that a lot of the patients coming to their clinics were food insecure, but had no way to sort of get them to services and supports after the clinical visit. And so they updated their electronic medical records, added 2 food insecurity screening questions that patients completed when they checked in for their appointment. And if anything was flagged, the medical professional, the healthcare professional, gave them the resources for local food assistance materials, organizations that were sort of relevant to what they needed. At the same time, in this day of data being tightly held, they were also able to share with permission the patient's information with the food assistance provider that they had partnered with at the sort of organizational level. So there was a follow-up from the food assistance site with that patient. And food insecurity screenings and referrals did increase, and also service provision for food security also increased. So this is a great example of doing something that seems very hard and almost impossible, updating electronic medical records, dealing with a lot of attorneys, thinking about data security and data sharing across systems and silos, but they made it happen. And so this strategy is now they're trying to expand it to other health systems within Montgomery County and also into other counties in the DC metro area. So it's a pretty promising, innovative way of thinking of health broadly and making it happen in very tangible ways. And then lastly, part of this is just sort of thinking about how public health agencies can be part of the solution in food system planning and response as we work toward health in all policies and put that into place in our communities. What is the role of public health and food security work? How closely aligned are food security or food assistance providers and actors within the food security system or food system working closely with public health? Bigger broadly and embedding it into sort of a community-wide strategy for health improvement. Next slide, please. So the fourth key is about establishing local systems to collect and share data. And so data are powerful, but a lot of times communities lack the capacity, they don't have the systems in place to put sort of get access to good data. So what can be done to sort of address this? I think it's just starting the work somewhere. Some of the work that we've done in other settings is to work with communities and do ecosystem mapping. And some of this is around, who are all the players in the food, doing work around food security in a given geographic place, as an example. And then understanding who those players are, where the gaps are, thinking about how partnerships between organizations and agencies, government, nonprofit, et cetera, smaller organizations can be improved, collaborations can be created and expanded, and so that their solutions and strategies can be taken to scale to have large-scale impact. And so that's really an exciting sort of way that ecosystem mapping be used in the community context. Within Montgomery County, they created a system called FoodStat. They worked with their county statistical department to create a food system tracking database for all food assistance providers. So there were some sort of common metrics in place that the county asked food assistance providers to report on a regular basis, how many people are being served, some demographics, et cetera. So that system is county-wide. It's a way to sort of get an understanding of sort of the breadth of services available and how they're being utilized. At the same time, there's always very important to collect information from residents themselves, conduct community food assessments at the resident level. So individual food assistance providers or agencies might be doing surveys within, their catchment area or the service or with their service participants. But to get a community-wide sense, you do need to do a community-wide survey, and it can be done, fairly inexpensively. It's not going to be perfect, and I don't think the goal should be perfect data. There's limitations in everything we do, but thinking about, how does this data collection opportunity fill a gap and answer a question that's really important. And Netta is going to talk a little bit about the food security survey that we conducted with her in Montgomery County. Above all, it's also important to disaggregate community level data. Montgomery County is a huge county in the DC metro area. It has great wealth. There's also great levels of disparities, and that would be hidden if we only looked at Montgomery County level data. And so by breaking down the data by race, ethnicity, by zip codes, we could see sort of the patterns of inequities as communities of color were facing food insecurity during the pandemic, before the pandemic and since the pandemic. So again, Netta will talk a little bit more about this when we get to her part of the presentation. But it's really important to break down the data in ways that matter so you can see these patterns and how they play out in your community and track those changes over time. Then all of what Elisa has shared and all of the data really need to come together to develop community resiliency plans. I think what the pandemic has taught us is the need to be flexible, adaptive, to build on best practices, and to be really nimble when issues come up. And so, it might be a major business that closes in your community that has a huge, that really increases unemployment. It might be a natural disaster, who knows, but to have a plan in place, to be prepared, to know who are the key players in different areas. If you are doing this work, so the defining health broadly, hopefully those linkages are in place in this plan as well. And so it's easy to know who to tap into and how to work together. And the data informs sort of what's happening and where the gaps are that need to be addressed. Next slide, please.
So like Evelyn mentioned, we want to focus the rest of our time today discussing a recent effort implemented by the Food Security Task Force, the Montgomery County Food Council, community partners, and us here at Community Science in collaboration with them. And this was the implementation of a resident survey to collect data about barriers to food access and the impact of the pandemic on those drivers to food insecurity that we discussed earlier. And this survey was implemented earlier this year between January and March. And it was divided in two parts. The first part included 9 questions about how residents have been accessing food during the pandemic, food access concerns before and since the beginning of the pandemic, and common barriers to accessing food. And then residents had the option of opting into a second part of the survey that included 9 additional questions about awareness and experience accessing food assistance programs and resources here in Montgomery County. And in terms of the process, this survey was initially developed by the Food Security Task Force in English, and then it was translated into 4 other languages spoken by most residents in the county. And these were Spanish, Amharic, French, and Chinese Mandarin. It was distributed by the Food Council in collaboration with county agencies, food assistance providers, and community partners. And 100 gift cards were awarded to randomly selected participants. And Community Science supported the Food Security Task Force and the Food Council in the implementation, the analysis, and the reporting of survey findings. And we really expect that these findings will be used to improve immediate and longer-term food security efforts by the different actors and sectors that have that play a role in the food system here in the county, including, of course, policymakers, the Food Council, elected officials, providers, and all the other partners that are on organizations that play a role supporting food security efforts locally. So with that, it's our pleasure to welcome our guest speaker, Netta Squires, who, as Evelyn mentioned, is the National Capital Region Emergency Preparedness Specialist for Montgomery County. And Netta also initiated and co-leads the county's COVID-19 Food Security Task Force that led these efforts to create and implement this food security, this COVID-19 Food Access Survey. So thank you so much, Netta, for joining us today. And it would be great if you could start us off by providing some details to our audience about the Montgomery County COVID-19 Food Security Task Force and what led to its creation.
Thank you. And first of all, thank you so much, Dr. Young and Dr. Gonzalez, for having me today. It's truly an honor to be here with you today. And this has been just such a great presentation so far to listen to. And your remarks have been really exactly on point with what we saw in Montgomery County and our lessons learned. And, you know, the 4 pillars of creating good food systems that you detailed are truly, you hit the nail on the head. And so I hope everyone's taking notes and going home to implement them. So yeah, let's start a little bit. I mean, just about the task force as a background itself, you know, the COVID-19 pandemic and the resulting economic distress really triggered this food crisis in Montgomery County and throughout the region and globally, right? And it deepened these really terrible inequities in our local food system as these unemployment and small business closures and health disparities were rising. Montgomery County has seen an estimated 50% increase in the number of residents accessing food assistance surveys since mid-March of last year, from 60,000 pre-pandemic to over 100,000 residents currently, with the most recent revised Feeding America projections for food insecurity at an increase of 13%, which is a 62% increase from our pre-COVID level. So, you know, if you think about how this all started, right, almost overnight, everything was shut down, right? People lost their income, their support networks, and this led to this immediate and substantial increase in the need, with a very significant decrease in available services and resources. Luckily, in Montgomery County, we did have a lot of pre-existing frameworks for partnerships and connections, and most significant in this arena was really the Food Council that had these relationships before with providers, and they, as you mentioned before, created weekly meetings. We did also have something called the Community Organizations Active in Disaster, a nonprofit in Montgomery, which created these frameworks. And as you noted earlier, you know, one of the pillars and most important things during a disaster of any scale, but certainly one of this magnitude, is coordination and leadership. And so having these pre-existing web of relationships and community leaders, such as Heather Bruskin, for example, the executive director of the Food Council, was really key. But being a disaster, the Office of Emergency Management and Homeland Security stepped into the game to try and bring its power of resources, right? Resource coordination. But we did identify one gap that wasn't solvable just by, for example, we were giving PPE, or we were giving, right, there was no hand sanitizer to be found anywhere at the time. So we had our resource requests mechanisms which we could get this out to food assistance providers. But there was one big gap that was not filled. So the nonprofit world was well connected amongst themselves, but they needed to be connected with government during this time. And so in that sort of framework and in that space, we created the Food Security Task Force as a partnership in leadership between the Department of Health and Human Services, the Office of Emergency Management and Homeland Security, and the Food Council as the representative to the nonprofit world. And, you know, coming from an emergency management background myself, as you noted earlier, I created it like an incident command structure. And so we had what we call unified command. And I think that that was a really very important success to being able to represent all three pillars that needed to make this work on a long-term basis. And so ultimately the task force provided not only resources, but actually strategy, right? And we wrote a strategic response plan. We got buy-in from leadership, and we got funding, which was huge. We went to council, we were able to request funding. We provided food resources, direct food resources, such as food grants, funds. We created a food access call center. But also, to answer someone's questions from the registration, we also utilized technology, right, to make it all work. We were able to bring in and leverage technology. As I mentioned, coordination is key, but Google spreadsheet may cut it for a small scale disaster. Unfortunately, a disaster of this magnitude required additional larger systems. And so the task force ultimately was really able to be this model and structure for the past year and a half that we've been working under.
Great, thank you for that background. It's really interesting to hear sort of how these existing sort of groups and to the capacities sort of came together to put the task force into place and to be able to sort of rapidly respond. And so one of the work that came out of the task force was the food access survey that Elisa talked about. So could you give us more background on sort of what prompted the counties to take this on? And was it something that you had done previously?
Sure, yeah, no, we haven't done this kind of survey before. So, since May 2020, the task force requested and received over $25 million from the county to meet food insecurity challenges that were created by COVID-19. And we don't take this responsibility lightly, right? We needed to know that what we were doing was working, but also how we can foresee what we need to be doing as we move from response to recovery. And we wanted to know what we need to invest in long term. We wanted to hear the community voice. So the ultimate purpose was really to just understand how Montgomery County residents have been accessing food during COVID-19, right? So we developed this online survey, obviously with you guys, but as a collaboration with Montgomery County Food Council and the task force. And it had these two parts. One was really this, how did you access food now as opposed to before COVID? And then the second part was additional questions about food insecurity and resident needs. And ultimately, what we really just were trying to achieve is just, like I said, collecting input from residents to guide the county's food distribution plans as we go into 2021, 2022 and beyond, and using residents' feedbacks on how the county can best serve communities and improve food access during, but also after the pandemic, because it's essential to be able to, for our program to inform our program implementation, our policy development, and any future funding priorities. And I will note that when we developed the survey, one of the things that was important to us was to do it in several languages. And so we did it in English and Spanish, Amharic, French, and Mandarin. And we did use incentives. So we used gift cards, for example, to help incentivize people to join. We did, $25, we raffled $25 gift cards and $50 gift cards, which I think, can help, never hurt people wanting to participate. And we did our distribution of the survey through some, very obvious channels like press releases and obviously the Food Council's distribution list, but also through some less conventional methods which we utilize, like the Alert Montgomery system. And if anyone's familiar with the Everbridge system, sending mass text messages to people who had signed up to receive food information. So those were just some of the ways that we were able to.
Thank you, Netta. Thank you so much for all that background and additional details about the survey. So can you tell us about what you have learned so far from the survey?
Sure. Oh my gosh, so much. So, I'll say there was kind of two parts to this, right? One is that we did learn a lot of information. And the other is that it gave us concrete data to prove what we were seeing either with our eyes or anecdotally, right? And that's tremendously important, especially when you're going to ask for money, is to have the data to back it up, but also obviously for strategy and implementation. And so just, specifically some of the key conclusions that some of the things we learned, right, through this survey, was that there was a really widespread impact overall across the county, right? So everyone was impacted by COVID-19 in terms of having greater food security concerns. All racial, ethnic groups, household ages, categories, service regions. So really this wasn't just one community that was impacted. However, with that being said, we did see that there was a really disproportionate impact of COVID-19 food insecurity on Spanish-speaking residents. And that obviously prompted us to ask ourselves many questions, right? Why, especially we know, for example, that in the county, 6% of or African Americans are 5 times likelier to be food insecure than white residents, and Hispanics or Latinx communities are 6 times. So why were we seeing this tremendous increase in Latinx communities and not in the African American population in our survey, right? So these are questions that we were able to sort of examine by seeing the numbers in the survey. And just, anecdotally, one of the conclusions that we were able to arrive to so far is that a lot of our African American community was connected to service prior to the pandemic. So this was not necessarily a new mechanism. It was increased, it was exacerbated, certainly, but it wasn't, but they didn't have to enter the system for the first time. Whereas a lot of our Latin American or Latinx population had not been connected before. And one of the other really unfortunate things that we saw is that they said, I don't know how to request help. 60% of Spanish speakers said, I don't know how to request help, as something that prevented them from asking for help during the pandemic. And so for us, obviously, that is, a huge takeaway to learn and be able to shape implementation of how we move forward. Another thing that I think we learned that was, really hard to see, right? It's really hard to see these numbers, is that 30% of our population had to go to more than 3 to 4 distributions to get enough food for their family. And that is troubling. You shouldn't have, and some reporting more than 8, that they had to go to over 8 locations to get enough food for their family for a week. And that's really significant, right? That tells us that we need to build internally better models where people can go to at most 2 locations, right? Maybe it's your Safeway or your local grocery store, and in addition, your food assistance provider that can provide you everything else that you need, and not having to stand in very long lines at several distributions to get a box of food that you may or may not eat, right? It may or may not be what you eat at the end of the day. Some other really interesting anecdotes that we learned. There was, a lot of people actually recommended improving transportation to make it easier to get food. And that was really interesting because in the county, obviously, public transportation is harder, right? It's not Baltimore City, for example, where there's a lot of public transportation. And a lot of these distributions that we were providing during COVID were grab and go, which meant you had to bring your car, drive up, they put it in a trunk and you go. So in theory, you could walk up, but how are you going to walk away with a big box of food when you're walking home, right? So those are things that are really important. And I think someone, again, in the question is asked about food deserts. And so food deserts are categorized as geographical areas that are really hard, that have less access to food generally in terms of grocery stores, big grocery stores, but also to nutritious food and fresh food. And so making sure that we have food providers in these specific locations that are accessible in these food deserts that are hard to reach is really, really, really key, and something that we were able to kind of see from the survey and hear what the community had to say about that. I have like a million more things, which I'm happy to go on about. Want to be respectful of time. So
No, I appreciate that. So your analysis of the survey findings, there was a lot in there, which I think was just really informative. I think would be helpful to hear, especially as we talk about those disparities that the survey sort of lifted up. I think things that you knew about, but you see it on paper. How will the county use the findings to address discrimination and sort of the structural racism that impacts food insecurity in the county? Like, what are the county's plans? How do you move forward, with that information?
Sure. Yeah, no, that's a great question, and certainly something that we are in the midst of implementing, working on, and developing. I think one of the really important things to recognize just generally is that food is a gateway to other services, right? And so it's really important to figure out, and using these numbers, how do we better connect all residents, right, to food resources and to programs, but especially, as we saw in the survey, from the survey results, the county's Spanish-speaking residents, right? And they were the ones that reported these greatest challenges before, right? And of course, since the pandemic challenge started. And so making sure that we really build this network of providers that caters to them specifically, that is able to reach these very specific populations, is really going to be key, and something that we work on. One of the things we built during the during the pandemic was a food access call center. And that was really key because, as we saw from these numbers, but also, probably as everyone else has seen in their jurisdictions, for a lot of people, this was the first time they ever needed to go to food distribution, right? It was, they lost their jobs all of a sudden, and they had 2 incomes, and tomorrow you don't have any income. And it was new to them. And since a lot of providers were popping up and closing, and it was in the landscape, not everything was on Google yet, right? Like, the landscape was very different. And so people needed somewhere that they can just call and have this sort of case management approach to getting food resources. And even there, we saw that our highest numbers in our food access call center were Spanish speaking as well. And so knowing that information really helps us to plan, to understand that we can't just take the call center away, for example, because the disaster is over. We may have to shift how it's done, but we need to maintain that level of service. We need to maintain a case management approach. We need to maintain people who can speak Spanish in the county, right? Who are case managers that have those language capabilities, so that we can continue to create these mechanisms and avenues for people to come into the system. And I think just unfortunately, it's not just the Spanish-speaking community. One of the things we saw in the survey was that we saw really low rates of involvement from Chinese, Amharic, French people, right, in the survey. And so that doesn't mean that there was less need there. It just, what it tells us is that there is a higher need to develop additional mechanisms to engage these communities and gain their input more. So, you ask how, right? Like, how do we do this? And some of the ways we can achieve this by is really to continue to build the capacity of the Montgomery County Food Council, for example, or other county agencies, or our local food assistance network, right? Making sure that they can serve both culturally appropriate food, which is important, but also linguistically capable, right? In the communities. And then, also connecting us as a county, making an effort to connect with these smaller racial groups. You tend to be more receptive to your own community leaders. And so really making sure to engage with their leaders so that they build that relationship of trust through them, their community, and they help as a gateway to get more services. Mapping is another really huge way that we intend to use to be able to make sure that there's equity. It was something we did throughout the pandemic, but we're resurfacing this again now, right? Making sure that there are food providers that are appropriate in size and in food distribution and in specific locations, especially those either food deserts or hard to reach or high priority zip codes. And so through mapping is a really kind of concrete and an important a way of doing that. But I think most importantly is really to make sure to provide wraparound services, right? If you need food, you likely need other services as well, like rental assistance or healthcare or education or support. And so as we're moving specifically in the county from response to recovery, we're really using these survey findings to conduct this sort of comprehensive and short and long-term planning for our COVID-19 recovery, as you know, the impact of the pandemic on food insecurity was so significant, and it's really helping us to implement the needs on an ongoing basis going forward. But I will say just kind of one last thing, and that's that I would recommend us, the county, and as well as other partners on the call, to do another needs assessment, right? To do this again, to do another survey, because the landscape's going to change. The needs are going to be different. The data is going to show us different results. And so if we want to know, you know, what we did, what worked, what needs to be improved, what are the real needs still out there, we're going to have to do this again.
Yeah, I think you touch on so many issues. It is, as we talked about, this it's really a systemic way that we need to respond to food insecurity. So it's kind of like top down, bottom up, across the board, and think to the broad scale change. So it's great to hear that some of the new services and ways to address food insecurity, like the call center, you know, are going to stay in place, you know, community for a little bit longer. So I think that's also, you know, ways to sort of, you know, change some of the systems and structures that can make things better for community residents. I know we're at, we've got maybe about 8 minutes for question and answer from the audience. We have, so I am going to look through the chat, and also some of you shared questions when you registered. So we'll do a little mix of each. I'm gonna share, oh, thanks, Jason. So I think for Netta, going back to you, as we think of national disasters or in preparation for another pandemic, what steps should organizations have to take to be better prepared? What are some recommendations you have there?
Yeah, no, I appreciate that question very much. So, I mean, I think it depends where you sit, right, more generally. But the biggest thing is planning, right? If you're a jurisdiction, those investing in pre-existing relationships and frameworks and building them is critical, and it's going to serve you well not only during the disaster but during blue skies as well. So it's a really worthy investment to make sure that you have that you have those mechanisms within your jurisdiction, or if you are an organization, make sure to get on, you know, your local food council's network and on the emailing list and be a part of those conversations. Because, you know, when the pandemic or hits or a disaster, you're going to need support, and that's one way to get it is if you have those relationships and connections. And for government, certainly, like making sure to work with your nonprofit world, making sure to work with your businesses. You know, one of the things I think we could have done a better job at is leveraging our local businesses. We did that to like a certain extent, but definitely something that would be that we can improve on. And so certainly I think that's kind of that preparedness, and from my emergency preparedness hat on, if I could put that on for a second, right? You know, create continuity of operations plans. It's huge. It's going to serve you well. I don't know how many people had telework plans before. How many people had an, you know, increase of volunteer emergency plan, right? Did you have them on your, were you able to go back into your facility to even get that information, right? So you really want to create a lot of these continuity of operations plan. Understand what are your mission essential functions. What is it that your organization does? What do you deliver? What do you have to, what can't you live without? And then how can you do it in circumstances? We're heading into hurricane season, shameless plug-in, right? Like, be prepared, think about these things, right? It's too hot, it's too cold. How do I manage my operations with all of that? And certainly as it pertains to food, we are responsible, especially as organizations and food assistance providers and government, we are responsible for lifeline, right? They need it. And so we have to be really thoughtful about how we can continue operations either under inclement circumstances.
No, that's, yeah, thinking ahead, unfortunately, for the worst case scenario. But yeah, hopefully there are the less relationships and lessons learned from the community's COVID experience that people can draw and build upon. So we have some questions around measuring food insecurity and questions about the survey. So I can jump in there. So one question is, how do you accurately measure food insecurity? And questions about where the survey is anonymous. Do you look at location of providers versus survey responses? So quickly, more generally, accurately measuring food insecurity, it also takes sort of a multi-method, multi-pronged approach. So The resident survey that Netta talked about was really instrumental in understanding the resident, getting voices and perspectives from residents directly across the county in the major sort of like service jurisdictions within the county. So the widespread to the community perspectives on how their residents are accessing food, barriers, et cetera. And then there's also, online systems through the county, so that's like online tracking that the local jurisdiction or government might be doing, or local sort of intermediary organizations like, in our case, the Montgomery County Food Council, sort of helping to implement as directed by the county. So there's sort of online tracking of food assistance services provided. Netta talked about, the mapping of resources. Where are the food deserts, and literally putting it on a map and knowing sort of where all the food, where food can be purchased or accessed in the community, and looking at that sort of geographically. There's the power of stories and qualitative sessions and listening sessions with community residents. None of these in isolation are sufficient. So they get a piece of the food insecurity issue within your community, but they all have valuable pieces to contribute, whether it's sort of the stories of how residents and their challenges, or offering up suggestions to improve access, or how to improve for the cultural competency of the services provided, et cetera, versus sort of like those big numbers and figures that, taking it to county council and say, here's, what thousands of residents say, so it really depends on your audience, but trying to looking at it from a multifaceted way. And I think there's data standards that we need to hold on to. At the same time, it shouldn't stop us from trying to collect, seeing a data collection opportunity and knowing it may not be perfect, but it provides, some answers to questions. It's not going to answer it completely, but fills in some of that pieces for your work, for your community, et cetera. I think we have time for just one more question. Elisa, did you have one from the chat that looked?
No, this is mostly about if we can share the instrument, if we can share results, and offerings of coordination, but I think the questions we have from the registrant that are left are one of those.
Something really quick to the data collection piece, and this is like just, it's challenging. It's very, very challenging, and the reality is that you don't get data from everyone. Out of 110 providers that we're providing resources to, 30 give us data on a regular basis, and so we can collect some of the data from what they say, but they don't necessarily have the right tools to measure that, right? And so I think one of the, not to sound too pitchy, but like sales pitchy, but I mean, one of the reasons that was wonderful to work with the Community Science Foundation was because they knew they were really pros at science and how to collect data and how to do it in a meaningful way, which was something that, we struggled with and are still struggling. And the results we got, we know are data driven in order to be able to really make those short and long-term funding. And that is invaluable to understanding what's going on in your jurisdiction. So thank you guys.
Thank you, Netta, and we appreciate that pitch. And I think, taking advantage of local data sources is really important. And I think for us at Community Science, our organization is actually located in Montgomery County, Maryland. So to be able to partner with people that we knew in our own sort of hometown and backyards was really just an amazing, really important experience to see the food insecurity, play out in our own backyard. So thank you for the opportunity to partner. And we're excited to, hear how you're going to take the information and move forward as you're focused on recovery now.
And Evelyn, there is one actual question in the chat about how did the COVID emergency response data intersect with learning about SNAP-Ed or singing people up for temporary solutions? And I think to this we can answer that we included questions in the survey for people who wanted to, who were willing to be contacted if they were interested in receiving help accessing these programs or being signed up. So that data was also collected, and the contact information that these individuals provided was sent to the partners that put together the survey so they could receive that follow-up.
It was anonymous for everybody, and if they wanted to get more support, then they opted in to share contact information. So, Well, I know we're at time, and I just want to thank Netta for your time and just hearing from you, so that the work that you're doing in Montgomery County and sharing the experiences, and that it's, it's a data-driven approach, and it's about putting all the other resources you have in the county to play to address and respond rapidly. Thank you for your sharing that experience and that perspective, and being flexible with us as we plan the webinar as well. And we will be sharing the recording and the slides with participants. I know that came up, so just wanted to say that on the session. But thank you to you all for spending time with us today. And our information is on the previous slide. So if you have any questions, feel free to follow up with us individually, and we're happy to have individual conversations with you. So wishing you all the best, and happy 4th of July weekend as well as we go into the holidays. All the best. Thank you.
Thank you. Muchas gracias.
Thank you for having me. Thank you very much.